Hello everyone, welcome to MDRP Digital Week, brought to you by the producers of the Face-to-Face Medicaid Drug Rebate Program Summit visiting Chicago in September 2018. My name is Carter Anderson. I'll be your moderator for today's session titled Price Transparency Laws, a Review and Considerations. First, I'll cover some quick housekeeping items. If you experience difficulties with audio or advancing slides, refresh your screen with F5. If you're experiencing other technical issues, hit the question mark button to receive assistance. At any time during the presentation, submit your questions into the Q&A window on the left-hand side of your screen. All sessions this week are being recorded. You'll be emailed in 24 hours when they are available for viewing. Let's now begin by introducing today's speakers, Partha Chatterjee, partner at Akara Group LLC, and Romit Kamdar, partner at Akara Group LLC. Thank you for joining us today, and thank you to Akara Group LLC for sponsoring the event.
Great. Thank you very much, Carter. Good afternoon, everybody. Thank you very much for taking a few minutes out of your day to join us for what we hope will be an insightful and informative discussion around state price transparency laws. We have taken the opportunity to compile some information that we think you'll find helpful as a synopsis of where we are in the industry on these price transparency laws, but also to try to provide you all with some intelligence as to what some of your peers are doing and how other manufacturers are addressing these new regulations that seem to be coming out pretty quickly. In addition to what Carter had mentioned regarding housekeeping items, we did want to just share some other things. We will refrain from any reference to any manufacturer names that we have spoken to and gleaned any intelligence from, for obvious reasons. That confidentiality was paramount to our conversation. In addition to that, just to be transparent, we are not lawyers. Much of what you will see will be interpretations as we understood them and our clients understood them, as well as counsel that we have spoken to. However, every organization, in my experience, every organization has a slightly different interpretation to what are seemingly standard set of regulations or guidance. So please take our understanding and then impress upon it what your organization and your counsel understands the regulations to be and what the requirements are. I'm going to turn this over to Romit to kick us off. He'll walk us through the agenda and give some good background, and then I'll jump back in a little bit later. Romit?
Thank you, Partha, and thank you to everybody for joining. To summarize what we will be covering today, in terms of background, this topic of price transparency really reached the top of our minds, just like it did for many folks when state of California passed their law, as it's the most broad-based and highest profile out there. So what we wanted to do is we wanted to summarize what's happening across various other states, whether they've passed laws or are proposing different types of legislation. So we'll do a bit of a summary. And then what occurred to us as well is it would be beneficial to share discussions we've had with various manufacturers on how they're reacting to these laws, how they're responding to them, and how they feel they'll have to prepare for them. So we will share some highlights of those discussions. And then finally, some practical recommendations. Our objective today is not to prescribe what we feel needs to be done for operational compliance. We know there's going to be clarification to laws that have already passed, upcoming, in months to follow. But we want to share some insights that we think are worth thinking about as you move forward in handling this as organizations and manufacturers. So moving forward, let's start with some background. One thing I will mention is this is the background as Akara understands it across states that have passed laws. Everybody interprets things a little bit differently, and certainly things change all the time. So if you're interested in a particular state or concerned of a particular state, definitely speak to your counsel, your government affairs folks, in order to get the kind of the latest and greatest as to what may be going on with any given state. This grid here, there's a lot of information, so what I'm going to do is summarize some highlights without going too crazy. There's 6 states here that have passed price transparency laws in the last, let's say, 18 months or so. California, of course, on the left is the most recent and kind of at the top of our minds, freshest in our minds. Quickly summarizing, California passed a law that said that if a manufacturer increases WAC greater than 16% over a 2-year span, they have to report justification to the state. And what they also say is when you launch a drug and the launch price of that drug exceeds the Part D specialty cost threshold, you also have to disclose information justifying that launch price to the state. One thing California said that's interesting in their law is that the manufacturer does not have to disclose more than information that's publicly available. So it leaves some questions as to if you're singled out as one of these states violating the 16% or the launch price, what exactly do you have to disclose? Louisiana, passed in June of 17, is a little simpler. They're simply asking for your current WACs on a quarterly basis. Vermont was the first to pass one of these such laws in 2016. The difference between them and, let's say, California is that they basically are saying that they will monitor drug pricing, and each year they'll identify up to 15 drugs that exceed certain cost thresholds, 50% increase over 5 years or 15% over a year. And once they single out those drugs, they would reach out to manufacturers for quote-unquote understandable and appropriate factors for that pricing. Moving on to Maryland. Maryland focuses on off-patent generics that they term, quote-unquote, took unconscionable price increases, where they say if the WAC increased greater than 50% over the prior year, they'll request the manufacturer disclose relevant documents defending that price increase. If the manufacturer is found in violation, they can take a couple of measures. One is they can have the manufacturer make the price right before the price action available to the state health plans for up to 1 year. And they can even impose a penalty of up to $10,000 per violation for the price increase itself. That is something that makes Maryland unique vis-a-vis the other states on this chart. The other states enforce civil monetary penalties only if you don't report requested information should you increase your price, but not penalizing the price increase itself. Nevada passed a law of singling out diabetes drugs, indexing it to the CPI for medical care commodities. If it increases greater than that CPI, they also request various information related to the WAC increase, discounts and rebates, and other information. And finally, the state of New York. This is probably the hardest to understand or most esoteric of these 6. And the reason why is they identify high-priced drugs based on a benchmark that the state sets itself. So there's less visibility into how they determine that rate. But this impacts both branded and generic drugs. On the generic side, they would identify drugs that increase beyond the state MAC by 75% after April of 2017. In either case, they would look to negotiate additional supplemental rebates from the manufacturer if they deem in violation. And the disclosure they request from the manufacturers to justify such increases is broad-based and far-reaching from price justification, costs, and other criteria. Moving on to states that have possible legislation in the works. There's over 30 states with over 80 pieces of legislation proposed at this time. So we're just going to zero in on a few to provide some context. If you're looking at this slide, you'll notice the state of Ohio, who voted on their legislation yesterday, and it was voted down pretty decisively. What their legislation proposed was capping state health plan prices at no greater than VA pricing. California proposed the same measure last year, and that was also voted down. And on this list, Massachusetts is considering the same thing. So there's a couple data points here of that VA price measure not making it through a couple of states. Separately, you have Michigan, Rhode Island, Tennessee, and Massachusetts, and they all propose elements that are similar to Vermont, where they would identify drugs that have price increases with a threshold higher than X% over 1 year or a higher percent over 5 years. So clearly they've borrowed a little bit from what's passed in Vermont. And they're also proposing similar measures for what would be required to be disclosed from the manufacturer should they be in breach, which is, again, justification for the price increase, information about commercial spend, R&D costs, and various other criteria. And then rounding out the list is, on this list is Montana and Oregon, and a litany of other states that are not listed here that are proposing similar factors. There's the question of why are all these states acting? Because clearly there's a ton of activity. And really, I think there's one clear reason for it is absent any federal action, the states have decided to make this a hot button issue. The Kaiser Family Foundation did a study last year and found that almost 80% of respondents thought that drug prices are unreasonable. And whether, folks on many sides of the industry may agree or disagree with that point, but the perception is real, and the states recognize that, and it's something that they feel they can act on at this time. To quickly give let's call it a shout out to the federal level, what's going on there is not too much, but there have been legislations put forward in Congress that haven't moved anywhere. One is called the Fair Pricing Act, which is proposed with bipartisan support by John McCain and Tammy Baldwin, Republican and Democrat, which basically proposes measures similar to Vermont and California. There was another act called the Spike Act that was proposed by a Democrat, which also does the same thing, but none of these have moved much further than that at this time.
And I think, to your point, it's also the executive branch of the government is also in support of controlling drug costs, drug prices, at least calling it out. And so who knows where the federal path might go.
One thing Partha and I have stopped doing is try to speculate too much on what the federal government's going to do, because it can change at any given time. So this leads us to the next slide and some obvious open questions we feel are out there. We don't have the answers to any of these questions, but we like to think we have some opinions on them. Number one is legal standing. With any law that's passed, there's the question of, one, will it be upheld, and two, will it be clarified or changed? California is a good example of the latter. Is it going to be clarified? We feel it has to be, and as many folks on the line must agree, that, how are we going to report the information that's requested? Where will it be sent? Just operational compliance concerns about how the information gets transmitted, how confidentiality is assured are at top of mind. On the second point of will these laws be upheld, we know PhRMA and the Association of Accessible Medicines have respectively targeted Maryland and Nevada in recent months, and federal judges in both cases ruled that the laws could proceed as is for the time being. So it's perfectly believable that PhRMA, Bio, AAM may look at, for example, California being the most recent and perhaps consider some action to take there in the interest of the industry, of the manufacturer side of the industry. Operationally, again, I mentioned this, how are reports going to be submitted? What is the point of contact for each state? How will updates be managed to information that's provided? These are questions that we have just like you folks on the line. And later on in the presentation, something that we have talked to some of our manufacturer clients about. Those open questions lead to some, what we like to think of as practical concerns. And we kind of group them into two buckets for discussion here. One is reasonable justification. So anytime the states are asking for justification of a price increase, what is the breadth and depth to which the manufacturer has to disclose? What we mean by that is the following. On the breadth side, for example, let's say the state is asking for commercial spend and does not clarify any further. We've had manufacturers and we've had conversations where it's asked, does that embrace R&D costs? And, and should those two be conflated or kept separate or reported at all? If you're reporting R&D cost, what happens if there's a failed R&D project related to the brand that you had the price increase on or to the franchise that you're dealing with? Do those need to be reported, and are they relevant to this disclosure? Also, price actions may not be exclusive to a brand. It might be part of a larger portfolio strategy or company operating plan. So justifying it with respect to a single brand might be a more challenging exercise. And how does that reveal itself in these disclosures to the state governments? And finally, as another example, what if you're taking a price increase to fund future R&D? How do you relate that to the justification of the brand on market at the time? On the depth side, as an example, what if your assumption is market share for your brand is going to decline? And as a result, your planned operating income will decline as well. The consideration may be is absent any other options, such as cost reductions, And in order to maintain a current operating budget, the manufacturer might decide to increase WAC. Does that kind of thought process and steps get disclosed? And if so, do those assumptions need to be clearly documented and footnoted, kind of not dissimilar to how SEC statements are done? A second practical concern is who will be involved and what is the nature of their involvement? When do they get involved? This whole process we're talking about for any given state can involve various work functions, from strategic planning and those that decide the price actions, to folks like pricing committee that evaluate contracts and deals, to managed markets operations and government pricing folks who may also be involved in those price determinations, or at a minimum submission of these points to the states. Oftentimes with price actions, they don't occur with 60 to 90 days lead time. So right there is an inherent business process change in how you handle those price actions if, for example, you're beholden to reporting to California. So identifying the level of the individuals involved, the seniority of the individuals involved, and how they work together in the start-to-end process most efficiently will be an important part of operationalizing these state laws in the most time-effective way possible. Now I'll pass it to Partha, who will talk about, especially for these questions and practical concerns, the pulse of the industry and what we learned in discussions with manufacturers.
Thanks. So what we wanted to do was, as Romit just mentioned, get a feel for how the industry was responding to these price transparency laws. And what we endeavored to do is embark on an informal poll or survey, if you will, reaching out to much of our community, people that are either clients or that we have relationships with, and really gauge 4 major questions: where they were in their price transparency reporting process, how their responsibilities were going to be aligned across our organization, so dovetailing with what Romit had just shared previously. What impacts to their business do you see? So this is kind of a broad sweeping question, and we'll provide a little bit more color in a minute. And I think probably the most interesting of it all, which is really getting to the heart or the intent of these regulations, is how will price transparency laws impact your pricing actions, if at all? As we said, in terms of the parameters, we reached out to quite a number of manufacturers, but had an opportunity to speak with 11, given our timeline, of varying portfolio types and sizes. So we did get a chance to speak with a number of big pharma, but also wanted to understand how small, even startup organizations are treating these pricing transparency. So what you'll see is sort of a broad swath of manufacturers. One note, we did exclude generics. It really was just in the interest of time and availability. But much of what we have spoken to generic manufacturers separately and where they are. And as I mentioned earlier, we really wanted to have an open-ended discussion. So we didn't develop formal hypotheses and conduct a formal primary research. It's really to get, as Romit said earlier, a pulse on the industry. So the first question, in terms of where are manufacturers, where are folks in terms of price reporting, setting up the process, I don't think it's a big leap of faith here to understand that most manufacturers are in a wait-and-see mode. Greater than half of our respondents were saying that there was a lot of lobbyist groups enacting some lawsuits, as Romit was saying earlier. And in addition to that, there's a lot of unknowns. In fact, there's probably more unknowns than knowns at this point. And so a lot of manufacturers are waiting for things to shake out before they actually start mobilizing. That said, we did find a couple of manufacturers who were a little bit less concerned because they were leveraging what they're already doing for price reporting, say for Vermont, as sort of a playbook on how they were going to be approaching this. In some cases, we found manufacturers more proactively looking at their current standing meetings, for example, for pricing committee and what have you, monthly meetings, and putting this as an agenda item. And just to provide a little bit of color there, they're not just talking about the updates as to what were the regulations stand and any additional guidance. But what they're also doing is giving an update as to how they're going to be implementing compliance with the price transparency rules. We think that's probably worth note that it's now become a bigger topic of conversation than a one-off, because it will have a routine nature to it, as we all know, since pricing actions are fairly typical or routine by nature. What we did find is a few manufacturers who are actively engaging on this and actually starting to mobilize by setting up a real project, charters, a work stream, dedicated resources, identifying stakeholders, and so forth. Obviously, we saw that as a best practice that we would encourage your organization to pursue. Recognizing that there's only so many hours in a day and getting your day job done, so to speak, is conflicting with some of these special projects. But as we know, time flies, and there's a lot of nuances towards the compliance with these regulations that we think warrant a little bit of time and thought. Can we go on to the next slide? So I'm going to take a minute to break this slide down a little bit. It's a little bit busy, but we think it tells a compelling story. What we asked manufacturers organizationally is how they were looking to align the responsibilities for compliance with price reporting. If you look at the x-axis, we actually broke down the process, if you will, into sort of three major buckets. One, owning the reasonable factors and justification. So in my mind's eye, I tend to think of this as a big, thick binder, right? And in this binder, there are various chapters, if you will, that would be filled in by different stakeholders. Core finance might have some information, sales and marketing, and so forth. So that's one process. The other part of this is really process stewardship, or owning the process from start to finish, and ensuring that nothing falls through the cracks, and shepherding this through to make sure that we're hitting our timelines and getting all the accurate information. The final step in the process, if you will, is the final submission. This seems a little bit mundane or small, but it's actually quite challenging, because if the trend seems to go the way that it's going, where we have 50 different states that have 50 different formats, 50 different portals or points of contacts and data information, who's actually going to be responsible for making sure that we get all this information out on a timely basis and that we're hitting our timelines? You know, just as an aside, a client of ours was joking that is he going to be sitting there on Christmas over the holidays submitting something in for Louisiana and then for California, and then, you know, missing Christmas Eve dinner because he's got all these submissions to do. So we do think that there's a fair amount of work that needs to be handled there. Now, what we did was we broke down the individual organization or departments within a manufacturer into different buckets. So commercial being sales and marketing, core finance, not knowing about everybody's organization, but we have encountered pricing governance to be a separate department, government pricing, contracts and pricing, and in some cases, you know, well, into those different departments. Unsurprising, you'll see the orange bars reflecting that most manufacturers are just not sure how they're going to do the implementation. And again, this dovetails with the previous slide, that a lot of manufacturers are in a wait-and-see sort of mode. Now, that said, what they do know with 100% certainty is that legal and public relations or corporate affairs will be heavily involved in this process, from not only defining what the requirements are, but to footnoting and redlining whatever gets disclosed or shared with the state. One thing that jumped out at us also was that commercial sales and marketing folks were largely absent from owning this disclosure. Sales and marketing is a broad, or the commercial organization is typically a broad sweeping organization, right? Owns market research, sales, as I said, sales and marketing, DTC, what have you. But in no case have we found any manufacturer who thought it was most appropriate for the commercial organization to be solely responsible for the disclosure of the price actions and all the reasonable justifications. And that sort of makes sense when you think about this, because this is really a control function, akin more to what finance does. And so it does, and even government pricing. And so it is not really, in our mind's eye, fitting the commercial activities and what traditional commercial organizations are responsible for. We did find some instances where government price reporting was expected to be involved, specifically in the reporting of these price actions and the disclosures. And our rationale in conversations with manufacturers, it seems to be because most organizations tend to think of the GP group as the ones who are responsible for reporting to states, be it their individual state Medicaid amps or handling claims and processing invoices and working with states individually. So a few manufacturers are considering the GP team to be responsible for the reporting. I think what was most insightful to us, though, and what we're trying to reflect as a best practice is a couple of manufacturers have already taken a stake in the ground saying, we're going to have our pricing governance team, those folks who are responsible for really scrutinizing how strategic price increases would need to be evaluated and need to be approved and so forth, are going to be responsible for this price reporting. So we see this as a best practice and something that if your organization does not have a price governance individual or team, may want to now start considering. The other thing we've been seeing is that core finance and contracts and pricing are presumed to be intimately involved in this. So each manufacturer calls their contracts and pricing team something slightly different. We tend to think of these folks as the ones who are responsible for the contracting and to understand when, say, a WAC increase occurs, what that might mean for, say, their price protection clauses in their payer agreements. So we definitely see contracts and pricing to be a best practice in terms of their involvement, and obviously core finance, given all the cost information that needs to be gathered and sort of put into this proverbial binder. The final thing that I wanted to bring to everyone's attention was that one or two manufacturers actually responded saying that they were going to follow the paradigm of what they do currently for Vermont. So what we would recommend is if you are currently reporting for Vermont, that would be a great place, a great starting point to think about how we would want to do what we do for Vermont, just expanding on it and building upon that. So then we started to have the conversation with manufacturers as to what is it, how do we envision or how do we anticipate these price transparency rules to impact their business? I think it's unsurprising to hear the far bar on the right that most manufacturers are worried about the significant workload that this will introduce. We had more than one person say that this is just too much for one person to handle. And so what we are anticipating is that, for lack of a better way to phrase it, there will be some onboarding of resources or reallocation of responsibilities where this will very well may become a full-time job for one or more people. And this, by the way, I think is universal, so that's why we're hitting 100%. Every single person we spoke with was worried about what the workload introduced would be. But we did explore other strategic concerns, right? If we're going to be having 60 days notice of a price increase, how is this going to impact my trade agreements in terms of the old school inventory management agreements and or DSAs, IMAs and DSAs and price appreciation credits, or how will this impact my returns? So a lot of manufacturers are I think this is pretty well known, are worried about how this might what the distribution side of my business, what will be the impact to the distribution side of my business. We did hear, though, some manufacturers express significant concern around their payer agreements. For those manufacturers that do have these payer contracts, you guys are aware that negotiations are tough situations. Your market access folks or field-facing folks are going in trying to achieve positive formulary position with no restrictions or what have you. And if that price disclosure is made public to your payer or to the customer they're negotiating with, there can be some concern about how that might influence those negotiations and where formulary placement might be. So, this does not even speak to the impact that people have on the price protection clauses that are littered through our commercial rebate agreements. I do want to highlight one thing that actually did not come up in any of our conversations, at least by a manufacturer, but we did have discussion with, which is the impact. Are you guys thinking that there would be an impact to ASP? I'm not sure what everybody's portfolio is and if you're worried about ASP, but just for a quick background, Medicare ASP, Medicare Part B ASP, is a price point that it's calculated and used fundamentally, along with other products that are similar or share a same J code, are used in order to inform what the physician reimbursement rate is for certain types of drugs that are typically injected or infused, but administered in a physician's office. So a curious thing here is if you know of your competitor increasing their WAC because you have that 60-day knowledge, presumably that would have an impact on what the J code, weighted J code ASP, and subsequently to the physician reimbursement rate. So if your competitor is taking a WAC increase, presumably the physician reimbursement rate is picking up to some degree, but your price is maintained, is constant. Does this all of a sudden now introduce an unintended benefit for you in terms of what that margin is between the prescriber's acquisition costs and what the physician reimbursement rate is? We did not, surprisingly, hear anybody think about what public disclosure of these prices might mean for your overall brand strategy and pricing strategy. So we would probably recommend, if you haven't started to think about this, it should probably be on your radar. So I think finally, for me at least, the most interesting conversation was whether or not the manufacturer community felt that this was going to have an impact on how they address pricing. Just as an aside here, we are in a unique space in the U.S. economy, in the U.S. marketplace, where we're being asked to justify our price increases and to give reasonable, quote-unquote, justification, where I have not heard that from other industries. Romit and I travel quite a lot, and we notice that our airline prices always seem to mysteriously go up, and I don't recall ever seeing a disclosure by United Airlines for why my price is going up for my trips. But we have this responsibility now to disclose that to the public and to justify it towards folks outside of our industry or our business. Now, that said, while that's being impressed upon us, the gross majority of manufacturers that we spoke to either don't feel that this will have a big impact on their business or, at a minimum, might inform how we take our price actions. In many cases, and this is public knowledge, many big pharma companies and many mid-tier companies have publicly disclosed that they take pricing very seriously, and that above all, they're concerned with patient treatment and patient care, including access and affordability. And so most of the manufacturers we did speak with do not think that this will dramatically change the way that they take their pricing actions because they already think about this, and they've always been doing this. I spoke with the client just yesterday, in fact, who was saying this is more just a operational thing or pushing paper, quote unquote, thing than it is a dramatic shift in the way that we do our business. Now, that said, some manufacturers that we did speak with did think that this would have a material impact on the way that they were going to view the timing and the amount of their price increase. Unsurprisingly, these are probably the more smaller organizations who have been by and large, flying under the radar, if you will, by comparison to larger manufacturers or mid-tier manufacturers with a broad patient base. So I don't know. I mean, for me, this was just insightful to see that, or to think, are these regulations having the intended consequences or the intended effect that they had hoped for? Are manufacturers going to be more sensitive towards taking price actions? And I'm not so sure if they're going to be more sensitive or if they're just going to be aware that this will be out there in the public domain and that they need to continue sort of doing what they always do, which is be conscious and mindful of the patient care and patient liability. So just to summarize some best practices that we were able to pick up from what from the manufacturers we spoke with, we would, again, recommend having somebody, a person or a small team of people who would be assigned as what we're calling a steward of this overall process to make sure that all the I's are getting dotted and all the T's are getting crossed, that this person will be responsible for establishing really a price action policy and a process, including, what data, identifying what data needs to be collected, who should be involved, when should they be involved, an overall workflow or timeline. We strongly recommend that you think about these price transparency laws in terms of your overall business, so how that will impact your future operations and any decisions that you intend on doing. So in pricing committee, for example, at least in my experience, when most manufacturers have been taking the price increase, while there's been great, healthy dialogue and conversation about the rationale and what's going into this price increase, it's not always documented in the cleanest of ways. And so I would recommend that you start thinking about that how do we make sure that we're keeping a strong paper trail, if you will, so that way we can easily pull that information out for the purposes of being compliant. And think about things like the cost of implementation. Is it really one person who's going to be responsible for this? Is it a team? Is it a cross-functional thing? I will say, just as an aside, what we've heard some manufacturers evaluate for California in particular is that is the cost of non-compliance worth the operational burden for compliance? Now, that might have been an off-the-cuff anecdote, but that is something that you put into the conversation about how it is that you want to implement this and be successful. I'd already mentioned the impact on strategy, ASP being one example. If it's not at the forefront of your conversations, it probably should be. I think the final recommendation we would have is that if it were my organization, at a bare minimum, and I had a designated person in, say, pricing governance responsible for compliance, I would strongly recommend that put together, again, that proverbial binder. I'm a big believer in keeping things very simple and having, for example, a template, a table of contents. What information do we want to disclose? Okay, who's going to be responsible for developing that information? What is the overarching process that we're going to be doing? What are the timelines that we need to hit? Engaging those stakeholders. So if R&D is going to be R&D finance rather is going to be giving some information that we feel is pertinent, start reaching out to them and talking to them about this, that this is pretty important and this is another responsibility that somebody within their organization is going to have. And inevitably, IT will be involved. So I would strongly recommend start planning for this in your IT budget for 2018 in terms of what data or reports you may need to pull. If you're pulling data from your contract management software, which is what I've heard a lot of, or your revenue management system, what I've heard some manufacturers do for compliance with Louisiana, pulling out WACs and so forth. Or if you're pulling from other systems, SAP, whatever. But really, what kind of data do you need and what kind of reports do you need in order to support your reasonable justifications? So in sum, I think if I were to put a theme to this slide, it would be act early and be clear on what your actions are. Because regardless of whether or not there's a stay or an injunction for California, as Romit had said earlier, other states are acting. and absence federal action, other states will continue to act. Alternatively, even if states do act, the Fed may still step in and have some required regulation. So I guess using a metaphor or euphemism, the door is open or the horse has already left the barn. And so these price transparency regulations, are, for better or for worse, are here to stay and will be probably more pervasive in the future. So with that, I'm going to turn it over to Carter with any questions that anybody might have.
Thanks, Partha and Romit. A few of you have already submitted questions, but we'll give the rest of you a moment to enter questions in the Q&A box to the left of the slides. Before we kick off the Q&A session, I have a few brief announcements. I'd like to again thank Akara Group LLC for sponsoring today's webinar session. Next, I'd like to quickly draw your attention to the face-to-face MDRP Summit. At this 23rd annual event, you can hear from over 80 expert speakers and network with more than 600 colleagues. The MDRP Summit will be in Chicago, September 2018. For more details, visit MedicaidDrugRebates.com. With that being said, I'll hand it back over to Partha and Romit to begin the Q&A session.
Thanks, Carter. So we do have a couple of questions. I guess, so the first question that we have is, do you think there will be any rollback of California or any other states? I think I just addressed this, that I think, and I was speaking to another client about this yesterday, that sort of, again, the horse has already left the barn, and I don't think that California will be rolled back or stayed. Of course, I'm not a lawyer, and I don't know if anybody really knows, but I do think that this will continue to be a problem or an issue that we're going to be addressing, and it will definitely evolve over time. There'll be more clarity. There'll be better infrastructure by the states. There may very well even be reference by certain states on other states, not only in their regulations, as Romit had said, but also in terms of technology or portals or what have you. So we have another question that came in on, do we see any foreseeable impact to government pricing methodologies and calculations? I don't know if you want to.
So the question is there any foreseeable impact to GP? So, I assume that the intent of this question was around methodology and calculations, and I think the short answer to that is no. Nothing that's being requested at this time would impact actual GP calculations. I guess the consideration more so would be to what Partha alluded to earlier in terms of GP involvement in these processes and where can they best make this happen for their manufacturer, whether it's submission or also, pulling together information. And then also from an analytical perspective, if you're analyzing the impact to ASP, if another member of the J code is taking a WAC increase, GP may have involvement from a forecasting perspective or an ASP analysis perspective.
We had a final question here. Are there any trends in the types of laws that we can expect other states to pursue? This is similar to what you were talking about on your summary slide. Okay.
Yeah, I think if we talk about trends, as we were discussing earlier in the state-to-state kind of summary, they already exist. We've seen in the states that have passed laws, we've seen differences, whether one says, if you increase WAC over a certain percentage threshold, another state says if you increase WAC relative to CPI medical. And then, you have a state of New York that says if you increase WAC relative to something that only we can see. On the states that have proposed legislation, like Ohio, Massachusetts, Rhode Island, Montana, they've basically taken a flavor of what the states that have passed laws have done. WAC based on a 1-year or 5-year threshold, just like Vermont, WAC versus CPIU. So it seems like some of those trends already exist. And then in addition to that, we've seen variation in types of products subject to these trends. California is any product with a minimum WAC of, I believe, $40 off the top of my head. Nevada says diabetes drugs. Maryland says generic off patent. So, states are taking liberties based on what they probably feel is most impactful to their state budgets. where have they seen the impact and where do they want to target. If anything, it will be interesting how new federal proposed legislations try to consolidate some of these things if they try to push forward and do something centrally. Do you have anything to add to that?
No, I mean, the other thing is the reasonable justification stuff, right?
Right.
The rationale for the price increase is something that's, I think, pretty common across the board. So I would say that's probably, if there's going to be a staple, that would be one of those things.
I guess the last thing I would mention on that point is some states like California are also requesting PBM's payers to disclose things like the rebates they receive.
Yep.
Some states are asking the manufacturer to disclose rebates and discounts relevant to the product in question. So is there ever a time where the two need to be reconciled, or the two are out of touch if it's a state that asks for both? So inevitably, new questions will come up as the states collect data due to this process. And, that's perhaps where things will get even more complicated. And maybe this is one time you kind of wish the federal government would just do something one way.
Yeah, and that, your point about the rebates being collected, that, if anything, caused me the greater concern, it would be around that, right? So how that information is going to be, how we're going to ensure that that information is kept confidential, because as you all know, it could be a very quick and easy step to then figure out what the net effective price was per account given, and effectively disclosing what your best price was for your account for a particular product. So that confidentiality and that assurance by the states that this information, should it be married up between what a manufacturer submits and what the PBM submit or the payers submit, that gets kept under lock and key, I think is pretty important.
So I think with that, those are all of our questions. We want to thank everybody for joining. We hope this is informative. If you think of questions offline, feel free to contact us. And with that, we'll turn it back over to Carter, the moderator, to conclude.
That is all the questions we have for today. Thank you both for an outstanding session. Thank you all very much for your time. Please take a moment to answer the feedback form that will pop up on your screen. On behalf of Connect 365 Life Sciences, have a great day.